Assalamu alaikum. My paper published in 2020 JOE by Natalia et al. Titled Success, Survival Rate and Soft Tissue Static of Tooth Auto-Transplantation. It's a retrospective study. Generally, when a child or adolescent presents a missing tooth, the clinical options narrow because of incomplete bone growth, and in order to re-establish function and aesthetic in such condition, auto-transplantation has been proposed as an option, which is repositioning of a tooth from a donor area to a site in which its function and aesthetic would be more relevant. Often, third molar are used to replace posterior teeth that present an injury that cannot be addressed by endodontic or restorative procedures. However, when the anterior maxilla is affected, premolars or canines are usually used as a donor teeth. The aim of this study is to assess the success survival rate and the soft tissue aesthetic of 44 cases of auto-transplanted teeth in which the anterior maxilla was the main recipient site. Methodology: a search in records of patients who underwent auto-transplantation of teeth from 1994 to 2018 was performed. The patients' records registered the causes of tooth loss along with the sex, date of birth, date of procedure, donor tooth and replaced tooth, and the main reason for tooth loss was 42 cases of trauma, with 1 case due to agenesis. The patient who had auto-transplantation of teeth to the maxilla were contacted for clinical and radiographic evaluation. The determination of success in auto-transplantation cases encompasses several aspects such as bone formation, root development, bulb generation, function, and aesthetic. For the success and survival rate of the auto-transplanted tooth, the tooth had to be asymptomatic with no pain to palpation or percussion and an absence of sinus tract or swelling, should present physiologic mobility and periodontal probe 3 mm. The radiographic aspect should present healthy periapical bone, absence of external and internal root resorption or ankylosis. For the survival rate, it was based on the number of teeth present in the arch but not presenting indication for extraction, and both the success and survival rate were assessed and compared at short-term period up to 10 years and the long-term follow-up 10 years or more than 10 years. For the root development, the tooth should present sign of root development of at least 70% of the length of a normal root. Root development was classified as complete, incomplete, or underdevelopment, and this classification took into consideration the stage of the root at the moment of transplantation and the stage of the root at the follow-up. For the aesthetic assessment, the image obtained were assessed by 6 dentists, including 2 endodontists, 2 periodontists, and 2 orthodontists. Each case was individually assessed, comparing the gingival aspect of the assessed tooth with the adjacent teeth, and the evaluation of the soft tissue was based on the pink aesthetic score and graded as a very unsatisfactory, poor, fair, good, or excellent. Basically, the evaluators were asked to assess the following aspect: the presence or absence of the mesial papilla, the presence or absence of the distal papilla, the level of the soft tissue in comparison with the adjacent teeth, the gingival contour compared with the adjacent teeth, and the color and texture of the gingiva. In the result, in regards to success and survival rate, 79% were considered successful and 20% unsuccessful. Only 1 tooth was lost and 42 teeth remained functional, so the survival rate 97%. In regard to the aesthetic, 40 teeth could be assessed and were considered as an excellent 30%, good 35%, fair 27%, and poor 7%. And there were no report of unsatisfactory or very unsatisfactory cases. Thank you.